August 23, 1948, Guatemala City. A woman is lying in a psychiatric hospital bed at the Asilo de Alienados. Her name is Berta. No last name anywhere in the records, just Berta. She has been sick for months, infected, reinfected, used as a test subject by a team of American government researchers who have spent 2 years operating out of this hospital without telling a single patient what they were actually doing to them. This is Berta. She was a victim of what would become known as the Guatemala Syphilis experiments. Today, the lead researcher, a US Public Health Service doctor named John Charles Cutler, opens his notebook and writes that Berta appeared as if she was going to die. So what does he do? He infects her again. Syphilis, gonorrhea in both eyes, gonorrhea in her urethra, gonorrhea in her rectum, all on the same day. Because the data was incomplete and she was still alive, and apparently that was reason enough to keep going. Berta died 4 days later. August 27, 1948. Cutler noted it, filed it, flew home, earned a master's at Johns Hopkins, became a professor at the University of Pittsburgh, served as acting dean of its School of Public Health, received honors, trained students, died in February 2003, described in his obituary as a much-beloved professor and a pioneer in preventing sexual diseases. The university named a lecture series after him. They shut it down in 2008 when a new dean found out what he had done. No announcement, it just stopped. This is the story of the Guatemala syphilis experiments. Federally funded, NIH approved, deliberately hidden. And when it was finally uncovered 60 years later, the US government apologized with a phone call and paid the victims exactly $0, not a single dollar, to a single person, ever. To understand why it happened, go back to 1943 and one number, 7 million. That is how many man-days the US Army estimated it lost during World War II to sexually transmitted infections. 7 million days of soldiers hospitalized, useless, sidelined by syphilis and gonorrhea, while the war needed bodies. The military wanted a solution, and it wanted one fast. Then Dr. John F. Mahoney at the Staten Island Venereal Disease Research Laboratory cracked it. Penicillin cures early syphilis. 1943. The War Department exhaled. Except curing it wasn't enough. The military wanted prevention. Could a soldier get exposed on a Friday and take penicillin Saturday morning and walk away clean? Could you stop the infection before it took hold? That question had only one answer: deliberate human infection. Find healthy subjects, give them syphilis on purpose, treat them immediately, measure the result. So in 1943 and 1944, Mahoney and Cutler ran exactly that experiment at a federal penitentiary in Terra Haute, Indiana. Volunteers, paid, fully informed, everything above board. It failed. Prisoners who knew what was being proposed were too cautious, too clean, too psychologically braced. The infection rates were too low. The data produced nothing usable. They needed people who did not know what was happening to them. That was not possible in America, not legally, not with the press, not with subjects who could speak. So they went to Guatemala. The decision was institutional. It went to the top. Surgeon General Thomas Parran Jr., the most powerful public health official in the country, the man whose signature approved the NIH grant funding the whole project, described the Guatemala choice in a private conversation. His colleague, G. Robert Coatney, from the National Institute of Health, wrote it down. Parran said it, Coatney recorded, with a merry twinkle in his eye. You know, we couldn't do such an experiment in this country. That was the full ethical reasoning. Guatemala's government was cooperative. The army said yes. The prisons said yes. The psychiatric hospital said yes. The local lead, Dr. Juan Maria Funes, chief of Guatemala's Venereal Disease Control Division, had been trained at the Staten Island lab the year before and had personally suggested Guatemala as the site. The Pan American Sanitary Bureau provided additional institutional support for what was framed as international health cooperation. In exchange, the prison got a movie projector, a refrigerator, medication. The psychiatric hospital got laboratory equipment. The Guatemalan officials gained international prestige and US training. Science has always been good at finding what cooperation costs. The experiments began February 1946 and ran until October 1948. At least 1,308 people were deliberately infected: prisoners, soldiers, psychiatric patients, sex workers, ages 10 to 72. The Presidential Commission that investigated in 2011, after reviewing 125,000 pages of documents, found zero evidence of informed consent from any subject in any population. None. Not even close. Cutler admitted it himself in a 1947 memo to Mahoney. He was telling psychiatric patients the procedure was a new treatment utilizing serum. He called this, his own words, double talk. Then he added, and this is where it gets to me every time, this double talk keeps me hopping at times. Like deceiving institutionalized people into accepting deliberate venereal infection was a mild scheduling inconvenience. The methods were brutal. First, normal exposure. Sex workers deliberately infected with syphilis were brought into the prison and paid to have sex with inmates who had no idea what was happening. When that didn't generate enough infections, the team escalated. They abraded skin on penises, on forearms, on faces, opened the tissue and poured bacterial emulsions directly into the wounds. They placed gonorrheal material into eyes, into urethras, into rectums. With the psychiatric patients, they went further. Needles at the base of the skull. Syphilis spirochetes injected directly into the spinal fluid, into the central nervous system. Cutler wrote that he thought this might also cure epilepsy. One woman spent 2 months paralyzed from the resulting meningitis. And then there was Berta, which is where we started, and which you now understand completely. Here is the part nobody can absorb the first time they hear it. The Guatemala experiments ran from 1946 to 1948. The Nuremberg doctors' trial ran from December 1946 to August 1947. American prosecutors were standing in a German courtroom arguing that deliberately infecting human beings without consent is a crime against humanity, while Cutler's team was doing exactly that in Guatemala City at the same time. 7 defendants were sentenced to death for it at Nuremberg. The Nuremberg Code dropped in August 1947. It hit American medical journals immediately. Voluntary informed consent, it said, is the absolute foundation of ethical human experimentation. No exceptions. The Declaration of Helsinki would later reinforce these same principles for international medical research. Cutler kept going for another 14 months, and in April 1947, New York Times science writer Waldemar Kempfert had already published that it would be ethically impossible to shoot living syphilis germs into human bodies. That phrase existed in print while Cutler's team was doing it. 64 years later, the Presidential Commission named its report Ethically Impossible. The irony was intentional. Cutler flew home in October 1948. Here is his career in order. 1951. Master of Public Health, Johns Hopkins. 1950s through 1960s, field investigator on the Tuskegee syphilis study. Yes, that one. The Alabama study where black men with syphilis were observed and denied penicillin for decades, and Cutler co-authored papers analyzing their autopsies. 1967, Professor of International Health, University of Pittsburgh. 1968, Acting Dean. 1990, donates all 12,000 pages of his Guatemala files to the Pitt archives, untouched for 15 years. 1993, PBS airs The Deadly Deception, a documentary about Tuskegee. Cutler appears on camera and defends it. It would be undesirable, he says, to go ahead and use large amounts of penicillin to treat the disease because you'd interfere with the study. 46 years after Nuremberg, on camera, defending withholding treatment from men who were never asked if they wanted to be in a study. 2003, he dies. Beloved professor, pioneer, lecture series named after him. Gone by 2008, quietly. The 12,000 pages sat in that archive until 2005, when a Wellesley College historian named Susan Reverby stumbled across the box while looking for something else. She verified the records for 5 years, alerted the CDC, had a syphilis specialist flown to Pittsburgh to confirm what she had found, then presented her findings at a history conference in 2010. Last speaker, Sunday afternoon, 50 people in the room. The story broke, October 1st, 2010. Obama called Guatemalan President Alvaro Colom personally to apologize. Clinton and Syphilis called it reprehensible. The Presidential Commission investigated for a year and released a 200-page report. Commission member John Arras of the University of Virginia described the researchers' attitude toward the Guatemalan subjects as pretty much what you'd expect if they were doing research on rabbits. And then, nothing. Every Guatemalan lawsuit dismissed. The last class action, 9 years in court against Johns Hopkins and the Rockefeller Foundation, was thrown out by the Fourth Circuit in March 2024. The US pledged $1.08 million in 2012 for Guatemala STD prevention. A 2024 review by bioethicist Paul Lombardo found no evidence that money ever reached Guatemala. Not $1 to any victim, ever. Compare that to Tuskegee. $10 million settlement, up to $37,500 per surviving participant. Lifetime US government medical care. A White House apology from Clinton in 1997, in a room face to face. Tuskegee's subjects were American citizens. Guatemala's were not. The outcomes reflect that difference with mathematical precision. The legacy of these experiments eventually led to the common rule, the federal regulations that now require institutional review boards to oversee human research and mandate informed consent. But for Berta and the others, these safeguards came 60 years too late. Berta died August 27, 1948. Psychiatric patient, given syphilis without consent, reinfected on the day her doctor wrote she was probably dying. Her last name does not appear anywhere in 12,000 pages of records. The man who infected her died a retired professor in Pittsburgh. His records are in the National Archives. Berta is still only Berta. This story did not stay hidden by accident. It was run abroad deliberately, so American law couldn't touch it. American press couldn't find it. American subjects couldn't report it. The files sat in a basement for 15 years. The man at the center died honored. And the courts, when finally asked to reckon with it, said they were powerless. The sick history exists because stories like this need to stay in the room. Subscribe. There are a lot more where this came from.